Hello everyone, Jill here with Om Shanti Healing. In this video we're going to be doing a full hour of foam rolling. Now I've been teaching this class every Wednesday at 7 o'clock at the gym, and it's really picked up momentum and people ask for it every week, and they're really starting to enjoy it. So I thought, instead of bringing in my short videos that I have on just specific areas of the body, that we can maybe run through a whole class together. So you can utilize these techniques and this awesome availability of the foam roller to help you with pain anytime you want. So I recommend the foam roller that's 36 inches by 8 inches in diameter. It's dense foam, but it's, you can squeeze it and there's a little bit of give there. There are rollers that are super hard. Don't recommend those, especially if you've never tried this work before. So we're going to start with the lower body and work upward. So what you'll need is just a foam roller. If you have a yoga mat, you can pull that out. If you have a blanket, you can pull that out, and that'll be for our arm to rest on when we're on our side. So that's where we're going to start, in the hips and in the glutes. So we're going to take our roller, and I'll be doing just one side just to save time, and then you can certainly pause and do the whole thing again, re-watch it, and then do the other side. So we're going to start in the hips here. So we're going to lift the roller up and bring that roller outside the hip. So you feel the little indentation on the side of your cheek here. We're going to be in that. We feel the trochanter of the hip right here. And we feel the crest of the hip, the pelvic bone right here. So we're going to rest that roller in between those two spots. So the top foot is really great to help you with steering and to decrease pressure by pushing that foot in the ground, and you can kind of lift off of the roller a little bit. So let's leave this bottom leg on the ground just so it's less intense. And we're going to come forward into that TFL. So as we angle our body, angle it kind of downward towards the floor and come to the front of that pelvic bone, you'll feel a tight, stretchy rubber band type of tendon in there, and that is a hip flexor muscle. So it's tight on everybody. Every time you lift your leg off the floor, you're engaging it. So we're going to get into that spot and just push down and rock a little bit back and forth. And remember, while we're on our elbow, we want to remember our yoga shoulders. We don't want to be doing this, right? We want to be grounding at the elbow, up and out, engaging that lat, tightening up around the shoulder, lifting up and out of the joint for support. Okay, so we're rocking forward into it, and then let's rock back. So that front foot's going to come to the back, and we're going to rock right into the side of the cheek. And forward again. Back foot to the front, and we lean into that TFL. Okay, and let's go back again. Right into the side of the cheek. Okay, so we're going to come back to the side and hinge at our ankles. So my pinky toe's down on the ground, and I'm just hinging at the ankle, creating a rocking movement. So we're going to try to get down to that trochanter, that bony knob outside your hip there, right below the socket, and then roll all the way up to the top of that pelvic bone. 6 to 8 inches-ish in most cases. Okay? So we're going to create a rocking motion, and we're coming forward into that TFL. Past the glute med and back into that piriformis. So we want to come all the way back to the sacrum. So we want to feel that triangular bone that holds the pelvic bones together, and push alongside that bone, and you'll feel some fun stuff in there. So we're still rocking a little bit if you want, or you could do single pressure and just hold it, whatever works for you. So that piriformis is about at the middle of the cheek. It's a major contributor to pelvic pain, hip pain, tightness around the pelvic girdle. So we want to definitely address that spot. And once you're about mid-cheek, right off the sacrum, you'll feel it. And then we're going to turn back to the side. back foot to front, and we come back to that TFO. And I'm kind of zipping through this a little bit faster just to save time. You guys take your time with it. If you need to spend several more minutes here, you go right ahead. I'm going to move on to the ITT band. So this front foot can push into the floor. We lift up, and we roll that roller about halfway down the thigh. Okay, so foot on the ground or foot floating on that bottom leg. And we're going to roll up towards the hip. So you see how my ribs are dropping on this right side, right? So as my ribs drop, we feel a little contraction on this side. But as we pull the roller down towards the knee, we lift the ribs up and we squeeze up this bottom side. And what that's going to do is going to take a lot of the work out of the shoulder, and you're going to prevent strain there. So we're just rolling up and down, mid-thigh, back up to the hip. And you can certainly twist and bring both elbows to the ground if that works in your body. So we're going to angle a little bit to the front and get more of those lateral quads and the very top edge of that ITT, and back down. Okay, engage your side to help you, and then we can turn the hip back and get into the inward rotation of that hip and get into the side of the hamstrings here. Lateral edge of those. Roll it out. Good. So we're going to lift up and we're moving down a little bit. So we're going to lift and we're rolling down to right above the knee. Foot to the front. See if you can get down on both elbows. And we're rolling up. Same side body engagement here. We're going to try to meet the roller where we left off last time. And then we're pulling all the way down to just above the knee. Tight core, tight side. And we're pushing back up. And then back down. Turn the hip out, get a little more on top. Good. Turn the hip in, get a little more in the back. Right. Now we're going to move into quad tendons. So we're going to get this spot right here. So we're turning to our belly and we're going to roll that roller up to right about the level of the pelvis. Okay, we're down on both elbows. We feel the attachment points here at the top of the quads. It's tight, tendinous here. So feel the bottom of your pelvis, the front of the pelvic bone there, that inferior iliac. And then we're pushing up past the bone, like right up in there. And then we're going to roll down past it. So I'm on my toes, and I'm hinging at my ankle, pushing and pulling. I'm using my core to help me. I'm using my front foot here to stabilize me. And we're rolling it out. So we run through that a couple times, and then we're going to get quads. So we're just bringing this other leg on top, and we're starting about mid-thigh. Okay, so with this one, we're going to pull the core up, okay, as we pull towards the knees, right? We're rounding the back, tight bellies. And then as we push up towards the pelvis, we're dropping the navel and we're contracting the back and the feet pop up a little bit. And then we're coming back in. Roller. And back up. So we provide our own downward pressure here with the weight of our legs, but if you want more, just push your legs into the roller a little bit harder. Okay? So we're turning in and out a little bit. Now let's move down. So my toes are down on the ground, I'm lifting up, and I'm moving the roller to the tops right above my knees. So we're getting the rest of those quads. Smaller movements provide less strain for the shoulders. So we do in two sections here for the upper leg because it's a long part of the body. So my belly's dropping, my back's contracting, and then I'm rounding, pulling my belly button straight up and tightening the core to pull to my knees, and then back up again. So I'm trying to just isolate the movement and trying to keep the shoulders as stable as I can while I'm here. Good, so let's turn the legs out and get adductors. So we simply widen the legs, we make a V. We turn the toes out, right? And then we're moving up. So we're doing the lower half here, which is down by the knees, which is, it seems to be a little bit more tender than up higher. Same movement, dropping the belly, tightening the belly. Good. So my toes are down on the ground, I'm taking the roller up, halfway, and then for here we can get up into the pelvis a little bit deeper. So we come up to the pubic bone. Ladies, you can maybe go a bit higher. And then we're coming down the thighs. Rounding and tightening. Belly drops, pull up, belly lifts, we pull down. A couple of these. Good, so we want to do, after this section, you can redo the video on the other leg. Okay, but I'm going to come down and I'm going to bring my legs to the floor and come up. Okay, so let's do hamstrings. Next, we're going to do hamstrings. So we're going to sit up on the roller and extend that leg out. So we want to have the hip and the knee and the ankle all lined up in a straight line, and we want to isolate the movement at the hip once we get in there. So we're not going to pull at the ankle for direction of the hip. So I'm up on the sit bone. I'm not on the tissue yet. Okay, I want to start, get myself set. My back leg, I've got my knee bent, and I've got my shin down on the floor. Okay, so we're going to place the hands on the roller and move forward a couple inches until we can sink into some sensation here where we're starting to feel those tense tendons. Okay, then to add pressure, pull your toes back, and we're going to move the hip back and forth. So internal rotation and external rotation. I'm turning the hip in and I'm turning the hip out. So to add more, you lean forward. Bring your hands out in front. So that shifts your weight more over the hip with your upper body weight, pushing down into the roller to add pressure. Another version of it is you can take your elbow to your thigh, right over the roller, and push down. And I want you to push from the top of your shoulder straight down into that leg. And then we can do the rotation again. In and out. In and out. So we do a few of these on both legs. You can roll or up the thigh towards the knee is anywhere you need to go with it. This spot here, that very first one, seems to have the most sensation for most people. When we move the roller more mid-thigh, mid-hammies, the sensation decreases when we're more in the belly of the muscle. So we'll just do one more section here forward, and then we'll move on. So I take my hands to the roller, I lift, and I roll forward a few inches and come back down. Pull my toes back, apply that additional pressure if I need to, and then we turn. Hip in, hip out. just like that. Now when you come off the roller, so you don't pull your groin, I want you to shift all your weight back into that bent leg behind you. And then we're gently pulling the roller out from underneath us. All right, so let's get the side. This is obliques and lats, right? We're gonna get into some rectus abdominis, tight core, tight sides, and tight low back. That's the next spot we're working on. So I'm right into the groove of my hip here, right? I feel the roller pushing into the top of my pelvic bone. And I'm gonna put my fist into the roller here and push that roller even harder into my hip bone. My bottom leg is gonna stretch out. That front foot is in front for steering, and we're coming forward. So I want you to keep pushing into that pelvic bone as we come forward and sink deep into those obliques. And if you can come forward enough to push into the side of that rectus abdominis, our six-pack muscles, and get all the way into the belly button, that would be awesome. And as we're doing deep work here, you can feel referral pain. So here, in this spot, you might feel some pains shooting down into your pelvis because we're just super tight right here. And this could be a trigger point for you in this area somewhere, and it could be causing some issues. So we're pushing, that front foot comes to the back, and we're rollering, keeping as low into the back as we can, and we're coming back. So our head's hovering. You can use your free hand to support the head so your neck doesn't hurt at the end. And I always do neck stuff at the end of my classes because this is a lot of work for the neck, but worth it in the end. So I'm pushing right into the side of my spine here, right into that tight QL low back stuff we got going on, and then I'm going to roll her back to the side. So 2 times in each section here, back foot to front, and I'm coming back through all the way to the belly button and pushing. And let's do one more just like that. We're coming back. Keep that push, front foot to back, support the head, and we're coming right back into that low back tightness, right through there, and we're pushing. So sometimes in class we hang out and we just kind of lean over the roller for a second and let ourselves stretch out in the front. So you can choose to do that if you want to hang here for a little bit. Just make sure that when you come up that you have that support for your neck, okay? And then back up into the side. Good, back foot to front. All right, so we're gonna move up into floating ribs here. So we're at the bottom of the rib cage, and right here we can get into some diaphragm, right? And some serratus here coming up soon, and we're getting obliques and lats too. Okay, so we're on our side and we're rolling to the front. So I want you to ride along the bottom of the rib cage there and keep pressure as consistent as you can. And we're coming all the way to the xiphoid process, the very end of the sternum, and pressing. And just the weight of your upper body should be plenty of pressure here because this can be a tender area. And then we're coming back, riding along those lower ribs, front foot to back, and we're coming all the way back. So let's hang out and rest over the roller and take a moment here. Couple deep breaths to stay. Good. Support your head. And then we're coming back to the side. Back foot to front and back in all the way to that sternum. And we press a little. So loosening up the diaphragm muscle will help you breathe deeper and easier. Super tight, big muscle that could get bound up under those ribs and restrict your deeper breathing, that yogic breathing we're all looking for, right? That slow, deep, complete breath that helps keep us nice and relaxed and calm through the day. Good. Support your head. And back to the side. Very nice. So now let's move up. So we're moving up the ribs a little bit. And we're sinking down a little bit lower now. Okay, so we're going to come forward along the ribs. So we're getting into some serratus here, which is a muscle used for exhalation in between, it rests on the ribs, and it comes up underneath that shoulder blade. So we're coming into the side, and ladies, don't be afraid to push into the side of the breast tissue a little bit, because we have stuck fluid in there, lymph buildup in there. We can get tender around the underwire area. So don't feel shy about pushing a little bit into the side of the breast to help loosen all that stuck tissue up a little bit and get more range of breathing and more comfort there in the chest area. So we're pushing a little bit and we're sinking low enough where we get good consistent pressure through the ribs, and we're rollering back. And maybe here we can feel the bottom corner of the shoulder blade. If you can catch it, push into it a little bit. I've got my hand at my head, I'm supporting my neck, and I'm rollering back. So we're coming all the way back and we're rollering over the roller and letting that head drop for a second. Just a couple breaths here. And on our way back up, we're supporting that neck and we're rollering back to the side. Back foot to front, and we come back in again. Another push. And coming back. One more time here. Front foot to back. Support your head. Keep pressure consistent. And we're rollering all the way back over the roller. And take a breath here, like 2-3 deep breaths. Good. Support the head. And we're coming back to the side. Okay, so now we're going to move up a little bit so the roller feels like it's right into the groove of our armpit, and we can sink down even lower now into pressure. So we're going to get the side of the pec. We're coming in, this is the pec tendon right through here, so we're coming in from the back side of that, and then we're going to come in from the front side of the lat back here. So we're sinking, that roller is tucked right into the armpit, and you'll feel that tendony, that tight, sore ball of knot right deep into your armpit where that subscap sits and creates problems. So we're going to come forward, and we're right into the groove right here of the shoulder. So we're coming forward and we're pushing down. Push right into that curve right there. Good. Super tender and tight. And then we're coming back, keeping that armpit pushing down into the roller. And as we come back, we're going to see if we can feel the outer edge of our shoulder blade. So see if you can feel for that, and if you can catch it, we're going to push, intentionally push into it as we roller back. And we're rollering right into that shoulder blade and then over the top of the shoulder blade, and we're laying back. So supporting the head if you need to. And then let's come back through. Deep pressure in the armpit, push into the outer edge, push into the front edge, right into that pec. We're coming back in and pushing. Good. And let's come back again. Catch that shoulder blade edge if you can get there. Push and roller right over the top, and we're back into pressure right over the top of the shoulder blade. And we're leaning back. Good. And come back to this side. Very nice. So let's get pec. So we're just going to swing our legs back And we're going to bring the roller to the front and send it over to the left side at a diagonal line. So we're back right into this spot right here. And we're laying down. So the roller's up far enough so you can rest your head on it. Okay? And we're bringing that arm out to full extension. Now turn the shoulder in. I'm trying to lift my arm up a little bit so you can see. Turn my shoulder in, your shoulder in, make a fist so your thumb is aiming at the floor. And then we're going to apply our own downward pressure from the back of the shoulder right here, pushing downward through the floor. So we're making our fist, we're squeezing, and we're going to bring the arm forward. And we're going to bring the arm back. Good. And then take it forward again. And bring it back. So we're just kind of desensitizing the area here. But let's try something else. We're going to turn that thumb up. So we're turning the shoulder out, and you can feel that knot right in your armpit there. Let's push into that and do a few of these. Again, back and forth, trying to keep that pressure as consistent as you can while we're working through here. A couple times. And of course, if you need to turn that shoulder forward again, do whatever you need to do. Both movements are helpful in different areas. So kind of explore, feel out what you need. Good. We're going to bring the arm back and let it rest on the floor for a second and just totally release tension around that shoulder. Just give it a break. If you have tingling or you lost circulation, your fingers are super cold, that's just pinched nerves in your body because you're super tight. Once you relax the area, the circulation will come back and everything's fine. Okay, so let's get into biceps here. So I'm just going to push the roller out a little bit away from me, and I'm going to bring my arm over the top. So I'm up on my other elbow, and I'm going to use my body weight to kind of lean, and we create our own pressure here, pushing down into the roller. So I'm coming back. So let's really turn the shoulder in so we can get that roller into the crease of our elbow. So as you notice, as you come down towards your elbow crease, it hurts a little bit more down there. Let's make sure we apply some pressure and get into that spot. We're leaning over all the way to the shoulder. Turn the shoulder out, explore here. Turn the thumb up, explore there. Odds are you will have pain pretty much all the way around the upper arm. Get into the bicep, deep inward rotation, and just kind of try to cover as much area as you can while we're hanging out right here. By just rotating that shoulder in, rotating that shoulder out, you will find a lot of knots in your upper arm that you probably did not know you had. And you can get all the way up back into that armpit if you want to go that high. Back up in there to explore the pain points that you've got right in there. I'm like right in the groove of my armpit, right underneath that anterior delt from where we are. And I'm pushing and rocking a little bit. Feel out that spot. See if you can break it up a little bit in there and get some of those adhesions out and free up your shoulder a bit. Okay, so we're just going to do a few more. All the way into that elbow crease and back up. All right, so let's move into tricep. So I'm moving all around just because it's easier to do one side with the camera here. So you can adjust ever so slightly, however you need to. So we're going to get a tricep. So my ribs are up on the roller, and I'm bringing the back of my arm to the top. So this top hand's gonna cup my biceps and push into the roller to create more downward pressure. And then we're gonna shrug the shoulder. So we simply elevate the shoulder and then pull it down, okay? And once I got my arm in place, I lift my ribs off the roller so I have more room to move, right? So we're up and we're down. And you can certainly go all the way up into that post delt and then back all the way down to the elbow and do it in 2 sections if you need to. And you will discover that you have pain here that you didn't know you had as well. So we can turn the shoulder out with this one, and you can turn the shoulder in. And just kind of explore what's going on right here for you. If you want to tighten up the upper arm, straighten out your arm, and then do it again. And you'll feel those muscles contracting. Quite a bit more alarming with the arm straight. We're turning in and out. Good. So let's get delt. So we're just going to scooch down closer to the floor. So the very top of my shoulder right here is going to be on the roller. Okay. So we're on our side and I'm leaning forward. So we're going to get lateral and anterior delt here. Lean and push down. And work from the bottom of the back of your shoulder rather to get that pressure. Kind of feel it from the back of the shoulder. And then we're rocking to the front, or rocking to the back rather. And then we're rocking back to the side and back to the front. So we're right at the joint here. We're right at the top of that shoulder. But our deltoids go down 1/3 of the way down the upper arm, all 3 of them. So we need to cover more area. We get one end here, yes, but we need to get the rest. So let's come back to lateral. And we're going to lift up and move that roller down about halfway down the upper arm. And from here, we're going to shrug. So we have that elevation, we shrug up to the ear, and then we pull down. And then back up. So once you get your rhythm, again, you can lean forward. So we're getting some bicep here too again, which is always an extra bonus. And you can turn the shoulder in and lean into get into tricep again too if you want. A little bit higher up into it. And we're working out the whole area here. Leaning forward and then back. Good. And let's sit up. Okay, so forearms. We're going to use the roller in front of us. And for forearms, we're going to do more neuromuscular technique rather than working in the roller on top of the roller. So we're going to take the forearm to the top of the roller with just the arm. And we're going to place the elbow right into our tight spot right here. Aim it like right at the bottom, like right below the elbow joint. You'll feel that brachioradialis. And we're going to apply single pressure into that spot. So where I'm on this part right here, I'm not right on the pointy part of my elbow. I'm on the flat part of my upper forearm here. And I'm working from the top of my shoulder and pushing straight down into that muscle. And holding it right there. And then we're going to lift the fingers up. And give them a little wiggle. And you'll feel all those muscles underneath there moving around. And then I want you to bring the pinky down. And then we're going to bring the thumb down. And we're going crossways across the muscles. Pinky thumb, 2 times or so. And then let's bring the fingers to your roller and push into the roller. And then we're going to relax. Okay, let's do that again. Fingers up, little wiggle, pinky, thumb, pinky, thumb, press, and release. So find some more spots in your forearm. There will be more, but when you're all done with it, go ahead and just run over it and smooth everything out, just to kind of soothe the area a little bit and create more of a clean slate, so to speak. And then we're going to turn that arm over, so my palm's up, and we're going to do the same thing. So find a spot, and you might find that you have more tenderness down closer to the wrist. We don't want to be right on the wrist, on the veins. Be just above that. Don't put pressure in the wrist. So we're finding our spot here. A little bit more pokey with the elbow, just because of the angle our body's at. And we make a fist. So these are flexors and extensor muscles. These are super tight from our obsession on our cell phones, pushing buttons all day, from typing on a computer all day, from using a mouse, anything that, playing a guitar, anything really. We use our hands all day, right? So we get tight through here, which can cause hand pain and finger cramping and lack of being able to stretch our fingers out like this. So I'm making my fist and I'm curling up and I'm contracting all those muscles in there. And then I'm stretching my fingers out. See if you can press your fingernails into the roller. Little tension there, and then we release. Let's try it again. Make a fist and curl up. And then stretch those fingers out and press. And then release. So again, a couple spots here. Even it out when you're done. And you're good to go. So I didn't do lower legs yet. I want to show you one thing with the lower legs, using the roller to get into the Achilles. It's going to be more in the lower part of the muscle of the gastroc and down into the ankle, just because the diameter of the roller is big enough where it's not going to fit right in the crease of your knee. It kind of slides down the leg a bit. But I will do another video on calf release using a tennis ball. We just need a smaller prop to get into the crook of our knee. So let's set the roller up where we're standing up on the knees. So we're going to take the roller, and I'm standing up on my knees, and I'm going to place the roller behind my knees. So we're going to sit down on the roller. We're going to take our hands to the roller first to hold it in place and to work with pressure. Push into the roller to lift your body off of it if you want less. So we're sitting down, and the roller's going to fit on your body the way that it does, right? You'll get the bottom of that gastroc. You might get halfway up, depending on, again, your body size and shape. So I'm sitting down on the roller. You can push into the hands and lift your body up a little bit more to decrease pressure. But I'm sitting down and I'm going to rock a little bit. So I'm rocking this way, rocking this way. Couple deep breaths so we don't tense up. Couple times. So then I'm going to come up and I'm going to move that roller down till it bumps into my ankles. And I'm sitting down on that too. So this is all tendon here, and you're rocking back and forth. So this will give you a good indication on where you rest your weight in your body. What side is sore more sore right here? Right or left? Notice in your body and your right here, what side hurts more? Do you have the same side pain in your back and in your shoulders and in your hips? Or does it transverse over to the left side or the right side? Opposite side. So we're rocking back and forth here and just working out the knots in these lower legs. Okay. So once we're complete, once you get your both sides done, then we're going to come up onto the roller and work the neck. And this is how we close, where we're softening the neck and we're taking our moment of shavasana, so to speak. So, just trying to get myself right with one cameraman around. Gotta do it all myself. So we're gonna lay down on the roller, and let's line up ourselves so the head, the base of the head, the occiput, is right on the ridge of that roller. Okay, so I'm looking up and I'm applying pressure into the roller. My feet are apart enough where I can balance myself, and my arms are at a nice soft cactus position. Okay, so we're looking up and we're pressing the ridge of that roller up into the base of the skull. And start to make some tiny yes movements with your head. So we feel the roller pressing into the two tendons there on either side of the vertebrae of our neck. Super tight spot and painful for most folks. So we're getting right in there. We're making some yes movements right in the tendon on both sides. Okay, so we'll do a few of those. Work that out for a moment. And then we're going to turn our head one way. So we're more on the one side of that tendon, so the roller's not on the other side. So we're angling our head to turn, and we're finding the one, and we're making some yeses. And then start to incorporate some no's. And we want to make sure we stay consistent. So as you're pushing into the head and we got the pressure, try to stay right on one spot at a time if you can. So yeses and no's, yeses and no's. Feel it out. Okay? And then we're going to go down an inch or so. So I scoot it up a little bit. And I'm down the neck an inch or so more on that same tendon. The same tight muscle in there. We're working into muscle now more. Yeses and no's. And then we're going to turn a little bit more and get the next spot. So you're just going to follow your body and what it's communicating to you. Find the next spot that hurts and work it out. Yeses and no's, and do the other side when you're done. And then we're going to get in between those shoulder blades a little bit. So we feel the shoulder blades clamping onto the roller, right? Let's just pull the arms in and stretch them apart, so we can sink those shoulders down and get a good grip around the roller. And then we're reaching straight up and we're releasing that grip. So we're stretching out, reaching up towards the ceiling. And then we're going to drop right at the shoulder, sink down, find the edge of your shoulder blades and squeeze into the roller. And then release and reach back up. And let's come down again and squeeze. And release and come back up. One more time. Pull down and squeeze and release. And then we're going to let the arms come out to a T and just hang out here for a second and relax the shoulders, relax the chest. Take your Shavasana moment here for as long as you need. Okay? I'm coming off the roller to close. So I hope this helped. The foam roller is really quite effective. I'm not going to lie to you. It hurts a bit. It's intense. You're going to have to breathe your way through a lot of it. But if you like deep, deep pressure, this is going to be awesome for you. And it's going to help you a great deal with your chronic knots and pain and trigger points. So let me know. I would love some feedback on my channel if you would like to give me some, or you can share with me in class how you like the roller. I got this one on Amazon. It's a Yes for All brand. I don't know if you can see that. Yes for All. On Amazon Prime it was like 20 bucks-ish. Super cheap. Don't buy them at Target. They're like 50 there. But anyway, these are awesome. for all kinds of stuff. And we'll be doing some more foam roller therapy here in the future. So stay tuned, subscribe to my channel so you can get the next video. And I wish you the best of days, lots of comfort and pain relief, and don't forget to hydrate when you're done. Namaste.